I'm Lindsay Broaddus, and today I'm going to be doing my IV therapy checkoff. So first I would start and make sure that my bed is raised, Cyril is down. I would check all my orders. I would confirm patient identify by using two methods. I would perform hand hygiene. My goggles are already on, and now I'm going to open my IV equipment on camera. However, it is all very messed up from practicing, so bear with me. So my 10 milliliter syringe, I would go ahead and open that, get it out, remove this, drop it into the waste bin, and then I would go ahead and bring it up some to make sure there's no air bubbles, and then place it back down. My ChloraPrep, I would fold it back like so, make like little boats out of it, and then IV extension, just rip it open, grab it, and then place it out. I have my tape, my tourniquet, this is also my patient, and then my catheter, bring that out, place it, my Tegaderm, just fold it back. Fold this stuff, and then my alcohol swab and my clean gloves. So first I would grab my J-Lube, I would grab an alcohol swab, and I would cleanse the end of it, making sure to wipe it down really good, and then I'll take that and discard of it. I would take my 10 milliliter syringe, attach it, and then if this was closed off, I would then unclude it so it's no longer blocked. I would then flush my J-Lube so that way it's not filled with air. And it's kind of hard to see, but it is dripping, so that means there is no more air within the J-Lube. And then I'm going to loosen this cap a little bit and place it back on the wrapper. And then next I would start my IV, and I will start entering towards the patient's torso, so towards like the elbow, to ensure that the catheter is facing toward, so that it's going into the vein back to the heart. And then I would perform hand hygiene. I would put my clean gloves on. The only way to know that you're using a good vein is to use a large spongy vein. Try to use the non-dominant arm. So like I'm right-handed, so I would want them to use my left arm. And we're going to try to avoid joints and arms that have wounds and or bruising. 3 fostering venous distensions. You can use a tourniquet, which is what we're going to use, a warm cloth, or you can have patients pump and make a fist. So now I would apply, scoot this down some, I would apply the tourniquet to the patient's arm using a easy loop, so that way I could easily pull when I needed to. So I applied the tourniquet, and then I would take the chlorhexidine and I would break the wings and clean the site with friction, scrubbing for 30 seconds, and I would put it into the trash. So we're gonna break the wings, and then we would clean, scrubbing the area for 30 seconds. Sorry, my marker may come off, so bear with me. Yeah, it definitely did. Okay, so scrub for 30 seconds. You're going to use a lot of friction, just making sure you really cleaned it very well. Okay, and then you would discard that into the trash. And then you would let it dry, not blowing on it or anything like that, just let it air dry. And then you would get the needle cath which is right here. And you're going to remove the cap. You would discard the cap into the sharps container. Make sure it's bevel up, from what I can see. Okay. And then once it dries, you would hold the needle 10 to 30 degrees and go in until you hit blood flow. So go in until we hit blood flow, which of course we're not going to get with this. And then you're going to advance the cath without touching the site. So you would advance the cath without touching the site. Remove this and discard of it. And then at this point you would pop the tourniquet. You would grab your J-loop. And this whole time you are applying pressure up here to the arm. You would take off this, attach it, okay, and then you would put pressure, remove the needle, put that into the sharps container. Apply that. And then you would grab your J-loop, connect it to the catheter, and place one piece of tape onto the patient, just for temporary placement, so that way it doesn't move. And then you would aspirate, which we're not going to get blood return on this, but hopefully you would in the hospital. And then you would flush. And then you would grab your Tegaderm. Grab your Tegaderm, and you would apply it to about right there. And then you would unclamp your J-loop, remove the syringe, and then you would put the syringe in the sharps container as well. And then you would remove the tape, and then you would place your permanent tape. There. And right there to ensure placement. And then on the Tegaderm, you would write the date, time, and initials on the tag. And that concludes my IV therapy video.